actually.
You're live now. Look.
What if we just do this?
I wish we could push one button and it would all happen at once.
All of them.
But this will
at
give
the
us
same
some time for everybody to look.
I don't know.
Okay, we're tired, but we wanted to try to be consistent with talking, and we're trying to figure out. Let's see.
I feel like that's worse.
You're cute, so it doesn't matter.
Leave it down. Woo! Okay. So
Okay.
topic today, I am going to lead this one. The children sound like they're coming in here, but tonight what I wanted to talk to you guys about. Hi, how are you?
We need to have like someone.
Okay, so I think I haven't addressed the turn of events of everything that is going on right now. So I kind of want to just say, hi, Jason, a little bit about, actually I don't. So I think what I want to say is it's a lot. It's a lot for all of us. I was debating even coming on today and if we were going to do this, but I also feel like there has to be some consistency in what we're doing, and just because of various atrocities, of course, that are going on in the world. I still have breastfeeding mamas, and we still have people that need help and all of the things. So tonight's talk is going to be focused more on my mamas and what some of the things that I would like you guys to look for and stress. This is knocking over. Do you want it like that?
I don't know.
Okay.
Well, you want to talk about what you do a little bit too, because I have people on my end that don't necessarily know what you do.
Okay.
And then I know everybody from your innovations page knows what you do a little bit.
Yeah,
Montika is
yeah,
awesome. She works with babies and mamas and more, but she does something that not anybody that I really know does, and she.
Is that on?
That's the watch party.
Oh.
So really, just here's our
Sorry.
focus.
Sorry.
And so she helps explain just a really briefly
So
what you do.
So I'm a nurse. I worked in the NICU for a long time. I've worked postpartum. I've done many things, but my niche, I would say, is working with moms and babies. And I'm also an IBCLC. I was a CLC as well. So those, when you're talking about the alphabet soup, maybe I can kind of talk about that too. So a CLC is a certified lactation counselor, and then an IBCLC is an internationally board certified lactation consultant. I don't really necessarily want to kind of go into all that. And then I'm a registered nurse, and I'm also a health and wellness coach and an herbalist. And so when I work with my families, it's more of a whole person care type of experience. So we touch on everything from, tongue ties or oral restrictions, gut health, mom's supply, lots of movement, just all of the things. But one thing that I feel like I don't hear a lot of people talk about that I wanted to touch on tonight is preparing for breastfeeding if you are planning on doing so, and being pregnant. So I know that I've talked to many midwives about the need to actually watch these mamas. And mamas, I need you guys to watch your breasts, watch and see what's going on with your bodies. Me and Dr. Crystal will definitely be talking about why is it only my head. We'll also be talking about parts of the body and knowing what the different parts of your body are, because I feel like as women and men too, there's this stigma about our private parts and
we're going to talk about this too, like in more depth. We're going to do anatomy, mostly female anatomy. Yeah.
Yes. So we need to know about what's going on and the different things to look for and so on and so forth. So one of the things, we've gotten really good about taking childbirth classes and getting with doulas and learning about, what to expect during childbirth and all these things. But what I don't see a lot of is women taking breastfeeding support classes or learning how to breastfeed and those types of things. And those things are really important. But things that I've seen that are also missing from some of those classes are, what you should see during pregnancy. And a lot of the things that make getting pregnant difficult are the same things that will make breastfeeding difficult for you as well. So if you have a history of like PCOS, which is why I also wanted to have Dr. Crystal on here, because when you're talking about women's reproductive health, breastfeeding, getting pregnant, it all runs together, right?
Because we're talking about overall health, and part of health, and it doesn't mean that if you choose not to have children, or if that's something,
right,
still the aspects of being healthy all apply,
right?
And so if we have healthy bodies, if we're going to have healthy fertility, all of those things. And so what you're seeing is a lot of times you've asked me, or kind of have me join in on some of your moms and babies even, to kind of be more comprehensive about how we can get these moms and babies, and then ultimately families, healthier.
Right, ultimately families. But when you're talking about the dyad, I don't know if anyone a lot of my moms have heard me mention the dyad. The dyad is the mom and the baby together, right? You guys are one thing. So that is a big deal when, unfortunately, we tend to separate the two. So we'll have the OB, or your mom, the mom doctor, and then we'll have the pediatrician doctor, but those two things don't always communicate, right? So we want to make sure, just like if you have thrush, that's why we always say, well, you want to treat them both. One of the people that I learned the most from in this line of work is Jennifer Tao. And one thing that Jen says all the time is heal the mother, heal the baby. And that is really, that's it, right? We have to deal with both of you. If mom is unhealthy and has different things going on, then it's going to affect that child. It's going to affect how that baby grows, that baby's genetics, epigenetics, all of those different things. Those things are there. So when you are planning to get pregnant, if you have had, let's talk about PCOS a little bit and some different things, Dr. Crystal, that you feel like people can do.
So PCOS is polycystic ovarian syndrome, and what's unfortunate about this in general, I'll talk about just the women that it affects, is it is actually considered an autoimmune disease. And a lot of times treatment or management of it is very unsuccessful. There's a lot of times they have a hard time getting pregnant. And there's a lot of things that go with that. So you're going to have cysts on your ovaries. That's going to be part of that. It's part of the name of the syndrome. But it's going to be in conjunction with issues with adrenal fatigue, but insulin resistance. And so a lot of times these moms can be, not always, have a difficulty losing weight, have difficulty maintaining blood sugar levels. And I will be honest, it's not a simple, it is a complicated.
Yes, it's definitely that.
And so there's a multifactorial approach that we'll have in treating a mom with PCOS depending on the issue. And the earlier you can detect this, it can be genetically linked.
Right.
We can help.
So when some of the things that I talk to my moms about, even when you're just looking at your cycles and things, do you have a history of having heavy periods, painful periods, those types of things? If you've had trouble getting pregnant, if, all of those different types of things are things that we're going to want to look at when we're talking about the ease of you breastfeeding for, the recommended amount of time for as long as you really want to breastfeed for. So I like to also tell my mamas, while you're pregnant, I want to see some good increase in your breast size. Your breast should increase in size during pregnancy. And then once you actually have your baby, your breast size should increase, more. And if you don't see significant increase during pregnancy, then we want to know why that is, what's going on with that. Because, I feel like people say that insufficient glandular tissue is not a thing that happens very often. But a lot of the times I see more often than I feel like is really, really reported. So you need to have that good breast. Hi, Megan. you need to have that good breast tissue growth during pregnancy. We want to see your breast tissue increase more during those first, few days after birth, and those types of things. So those are things that when I get a mom and we're 2-3 months in, and then all of a sudden she's losing her milk supply, we don't know what's going on, while we're trying to figure out and put those pieces together, those are the kind of questions that I always ask. But those are things and warning signs that you guys can also, as a woman, say, I noticed that, this didn't happen for me, or I do have a history of PCOS, or, whatever those things may be. We want to really pay attention as women to our bodies and the different changes and things that are going on, because even though having severe pain not breastfeeding during your periods is a common thing, that's not what we should have.
And some of the things is sometimes we don't think about how our body should be when we want to get pregnant until we're ready to get pregnant. Right. And I fortunately have had multiple young ladies, and I say young ladies because they're younger than me.
Right.
But in their 20s, 30s, typically they're ready to have baby. And I have had a few that are planning 2 to 5 years ahead of time. And really, as parents, we should be treating our children and being healthy, so they're healthy, so that they can be healthy as they get older, which reproductive health is going to be an offset or be an outcome of that good reproductive health.
Right. So even with that, what you just said about our children and our teenage girls, and those teenage girls going into their college years, getting on a good making sure that you have a good source of folate in your diet. There's definitely different types of supplements and things out there.
Do you know how to get folate in your diet?
Food is my favorite. Is my favorite source.
So green leafy vegetables,
yes,
which most people
don't eat enough of. Right. Mm-hmm. So we talked a little bit about that a few weeks ago. But if you're not in the position to where you can get a lot of good green leafy vegetables, there are different supplements that are out there, but you want to also be careful, right? Because most of the things that we see for prenatal vitamins are going to have folic acid in them. Mm-hmm. And folic acid is not what we want. It's not easy for your body to process it. And for people that have what's called MTHFR, which we will not go into that.
The whole thing. There could be a whole...
Right now, it could actually be not good for you if you have MTHFR. So we want to we want to make sure that we get the folate in our diet, preferably from food, right? And your green leafy vegetables. But if not, if you're going to take a multi or a prenatal vitamin, then you want to have one that has the methylated folate in it.
5-TH, yes.
Say it, because I can't say it.
Methyl tetrahydrofolate.
There it is. What she said. So you want to say it again.
Methyl tetrahydrofolate.
There it is. So she said it again.
So MTHF, it's almost like a dirty word. MTHFR, MTHF. That's how I remember it. Because it's,
that's
if you look...
clever.
It's clever.
It is.
It kind of makes us not sound so innocent.
Oh my goodness. I don't know about all that.
But that is one, and it is. And even though you can get it through your food, if you are in childbearing years and you're a woman, I would recommend going ahead and taking a multivitamin that has more like a prenatal, because that way, when I'm capable, meaning you are in childbearing age and you're having sex. So if you're not having sex, you're probably not going to get pregnant.
Well, there's that. So the other thing with that too is a lot of times I deal with babies that have oral restrictions.
Yes.
And when you're talking about oral restrictions are midline defects, and midline are things that form on the midline. And when you look at it from embryologically, that's within like your first 4 weeks of life. So the issue with the first 4 weeks of life and your heart and your tongue and your spine and everything developing during that time frame, most of us don't know we're pregnant during the first 4 weeks. We don't find out we're pregnant until we miss a period, and now that month has gone by and that baby has been developing for that amount of time. Yes. So if we can get a jump on it and already have our bodies in position to where we have this folate rich diet, to where we're making sure that we have the nutrients and the minerals that we need, which are a lot of them. And we'll go more into specific nutrients and stuff with Dr. Crystal at another time. We're not going to do that tonight. As far as what we really need to have, we talked a little bit about it last week. So if you want to go into and check out the previous two videos, every time I feel like we've touched here and there on different nutrients and things that are going to be important. But I know Dr. Crystal talked specifically about the baseline nutrients. Didn't you say that last time?
Yes, we talked about and all of them are baseline, but what I find in people that are usually deficient, and folate and B12 are two things that I didn't actually mention. Trying to keep it simple, but those are two things. It's really, sometimes I just want to say, take everything, because we do. Most of us are missing most of our vitamins, and they are so essential.
Yes, they are essential.
Our health and our cells and bodies functioning optimally. And
yeah. And a lot of that has to do with our diet, I think, and that's that's how we got in the caveat last time, because we were talking about things that we can do to decrease our toxic load, and we were talking about the foods that you eat and eating organic and making sure that we get nutrient dense foods. But even because of the processing of things, foods aren't as nutrient dense as they used to be.
It goes all the way back to the farming.
Yes.
So the soil, the timing, all of it.
All of those things. So other things that I wanted to touch on tonight, as far as, making sure that you are preparing yourself for breastfeeding, if that's something that you want to do. Research your lactation consultants. Find out what a lactation consultant is. Research them, interview them, just like you would your OB or your midwife, because it's an intimate thing. The relationship that you build with your lactation consultant. Most of my clients, or a lot of my clients that I have worked with, are still, we're still close today. We still talk. I still get pictures from them, and so on and so forth. It is a time in your life that is so pivotal when you're making the change to be a parent, from being, by yourself, or even just adding another child, into it. Because being a new mom is hard. Being a new breastfeeding mom is hard. And then you add breastfeeding challenges on top of it. Just being able to have someone that's there with you, that understands and that can support you, is really helpful. So I would definitely look into those things as well. So, interview, find out who your providers are, find out their background, find out their education, learn about these things, get a doula. If you choose to birth in the hospital, even research your doctors, you know what I mean? And word of mouth is a good thing too, talk to your friends and family and all of those things as well.
And I want to say too that one of the things is that some of us as mothers, especially, and not even new mothers, we don't always know if we need a lactation consultant. We don't know, even if we'll say, I don't have that many challenges, but some things that are not obvious as challenges. I will talk to some of my patients, and they will tell me things about their breastfeeding relationship, or even when I used to teach some of my students, and they were taught that some of these things were normal medically, and then they don't, and they give up on breastfeeding, or they say it's not just for me. And so what I would probably say is, and I want every mom to really want to breastfeed. Yes. However, we're not going to get into the discussion, if you choose not to breastfeed, that is your choice. But if you choose to breastfeed, I really would encourage you to go ahead and seek out a lactation consultant, so they can examine, they can look at the baby to foresee anything that can be happening, and really just walk with you through there. You may not need extensive help, but I think it's invaluable. Some of the things that Montika has shared with me is just invaluable information. I even talked to another doc, and him and his wife are doctors, and he was talking about, we're just going to have Montika, as soon as the baby is born, within a very short period of time, come and evaluate, because they want to make sure there's no issue and that everything's going, and to me that it's almost preventative.
Right. And I think other things that you guys have to understand as well is that, I was a lactation consultant in the hospital as well. And when you're in the hospital, we unfortunately just don't have a lot of time to work with mamas. It's not that we don't want to, but we also can't time, right, when your baby is gonna nurse and when you're gonna be sleeping with our next person and this, that, and the other. So a lot of times you'll have lactation consultants that come to the room, and they come to the room and baby's not hungry, or baby is sleeping, or baby is not there, and those types of things. If you work with it, because I have so many followers that are not here in Tulsa, Oklahoma, but there are private practice lactation consultants in most places. I would suggest definitely seeking one out and finding a private practice lactation consultant, or even finding someone that that can come to your house and spend some time with you, because babies, they're not on a schedule, right? They're going to eat when they want to eat. They're going to, they may poop or whatever, while you're trying to work and get that help you need. It's hard to squeeze that into a 15-20 minute visit at the hospital. So I definitely, want to advocate for private practice lactation consultants as well. And then also having somebody come into the home, it's different. It's different when I go to somebody's house and I'm able to help you there with your equipment, with your things. It's just easier for moms to reproduce what we were doing there at your house than it is when we work on this in the hospital, and then you go home and you're like, well, it worked on that chair and so on and so forth. I've seen moms go and try to buy the equipment that was at the office or at the hospital, so that they think that it was the chair or the whatever that did the trick. And we really want you to find your pattern at home with your own baby. So with those types of things, again, preparing for breastfeeding, taking a class, and there's a lot of online classes now that are out there, so you can know what to look for if things are not going well. Understanding that breastfeeding should not be painful, no matter what anybody tells you. It should not hurt. You don't need to toughen up your nipples. I don't understand how all of these things still come out there. I will say that outside of popular belief, I think that waiting long extended periods of time to introduce the bottle, sometimes that gets hairy as well. Especially if you have to go back to work and you're going to be introducing the bottle. I would say a few weeks in, maybe 2 or 3, you want to start, showing the baby the bottle and those types of things. If not, it's going to be more difficult to get that baby to take the bottle when it's time for you to go back to work.
And I think that's where, when someone like you can step in, and someone who has a unique situation or a situation, you can kind of customize or give advice that's going to be very specific for them, because not everybody's the same.
Right.
And
you may be a stay-at-home mom, and you don't have to do that. Ideally, we'd all be able to stay home and nurse our babies, and no babies would need bottles or pacifiers or whatever. We can just hang out and do the things. But the reality of that, most of us, or many of us, have to pump, have those types of questions and things like that. So, your lactation consultants are skilled to not only help with breastfeeding, but to also help with bottle feeding, to help with, what pumps that you need if breastfeeding isn't working, if your supply isn't doing what you need it to do. And if in all of those things, there is a reason behind every breastfeeding situation. So if you get, even if your issue doesn't happen within that first couple of weeks, if everything was going good and then all of a sudden 2 months in your supply tanks, that's a problem. Your supply shouldn't tank. I hear so many mamas say, well, I tried to breastfeed and it lasted for a few months, but when baby turned, this age, 2 or 3 months, then I ran out of milk. We shouldn't run out of milk. If your milk is being extracted, then you should continue to make milk. I hear moms, well, it must be a hormonal thing. Well, if that's true, then we can address the hormonal and work on that. But you shouldn't just run out of milk. There's something underlying that is going on. And so a lactation consultant, a lot of the private practice lactation consultants that I work with and learn from are extremely knowledgeable and have spent thousands and thousands of dollars and have seen thousands and thousands of babies as far as getting the extra education and classes and training to be able to work with you guys. You guys are why we do what we do. We love what we do. We love y'all. We love these babies. So, pay attention to your bodies. Look for that breast size increase. Before you start having babies, you want to make sure, or thinking about having babies, you want to make sure that you're taking care of yourself, right? That you're as healthy as you can be. You're getting ready to grow a person. So you really, during pregnancy, it makes me sad when I hear people say, well, you're pregnant, you can eat whatever you want to eat. No, we're not eating whatever we want to eat. We want to eat good, eat clean, get our exercise, get ready.
Because whatever we are, what we don't realize is when we're pregnant, whatever we dump goes to that baby.
That's right.
And so we want to be as clean as possible.
Right. And going through labor is like running a marathon. You know what I mean? So the better you can be in shape for real. It's not a game. Like hours.
It's the hardest thing I've ever done.
Girl, I was in labor with Agape for 42 hours.
You beat me then. I was like 36. I had,
my God.
and I know he's not watching, but I have a friend, and me and his wife, and we were arguing because he is a man. He said that running a marathon was harder than having a baby, and I'm like, well, you haven't had a baby.
Had no baby.
You can't say that.
No,
having a baby,
it's hard.
And they say you forget the pain. I did not.
No, and I've had I think I've done everything. So I've had in the hospital, epidural, the whole thing.
Did you have one at home? You did?
No,
you didn't.
We tried to have Agape at home, but Agape did not want to come out.
I tried to have one at home too.
Which is just like Agape, for those of y'all that know.
Yeah, Jake. Well, I have one. And
she's like, I'm going to do what I want.
Do.
Yes, and did not want to come out. She was my first, and we started at home, and then we transferred to the hospital. My midwife just kind of changed roles, and she turned into my doula, and it was a great hospital birth. I would say it
was not here. It was
that was in California. My most difficult, and in California, it was very different because the midwives had good relationship, with the hospital.
It's getting better here. A little bit.
Yeah.
We know a couple of midwives that's been doing it for a very long time.
Yeah. I know some awesome midwives. And so, it's still, it's completely up to you. But since you mentioned midwives, and I again am tired because of the state, I think, of our nation and everything that's been going on.
It's a lot. I'm
not going to harp on that, but we have so many disparities, not only in our justice system with police and those different types of things, but also with our maternal and child health.
So, just because we're talking about that, we don't focus on a lot of the statistics in other states necessarily, but the statistics in our state. And so no matter what, I guess, your stance is on the racial issues that are going on, which I think most of us can agree on quite a few things. But on that note, there is obvious differences in healthcare and disparities and gaps between let's just give them two statistics, I will say, with black babies and black mothers in the state of Oklahoma.
Well,
Do you remember that?
Are you asking me? I thought you were getting ready. I thought I was waiting for her. I was waiting for her to say it. But I know that our black infant mortality rate is out of 1,000 births, it's like 4 point something for our white babies, and for our black babies, it's like 18 and some change.
It's over 4 times.
It's over 4 times,
and it doesn't make sense.
And that's as far as that's babies dying. That's our black infant mortality rate, and our black maternal mortality rate mirrors that very much. And so, that's something that's very close, to my heart and to what we're doing. And we definitely want to encourage more black women to go into midwifery, to go into lactation.
Did you show me that they're giving grants for minority women?
No, you didn't. I did not show you that, but I want you to show me that later.
Oh,
because
on Legendary Milk on their Instagram.
Oh yeah. That's right. So Legendary is doing. I think she's training for COs. I don't know what. Maybe a certified breastfeeding educator. I'll post a link on Innovation's page for those of you that are interested in doing that through Legendary. She's doing a scholarship for black women to become certified breastfeeding educators. Legendary Milk is a great, she's got some great products. She's got a great support group that she has, Legendary Mamas, that I really like and that I'm a part of as well. But there's disparities everywhere, and I've had different people ask me, well, what can I do? I feel like what needs to be done is find something that you're passionate about, right? And then find somebody that's on the ground doing that type of work. Mm-hmm. So if you're passionate about moms and babies and you want to be an ally, then find out what organization or people that are out here working trying to get care to these families. We have an awesome nonprofit that Dr. Crystal and I are a part of, Innovation Family Wellness. We put the Lift on here in Tulsa every year, the Lift Every Baby, which is during Black Breastfeeding Week. And we are working very hard to get grants and funding to train IBCLCs, black IBCLCs, and midwives, and not just black, honestly. For me, I feel like it's for everybody that is of color, because there's already white representation, and I have so many friends that work in the Burmese population, and there's no Burmese women to work in the Burmese population, and it would be awesome to train Burmese women so that the Burmese women who understand the culture and the language can help those women. And same with Hispanics and blacks. The research says that is where the
disparities are.
That's where the disparities are, but that's also where the best help comes from. So when you look at the research, yes, as far as receiving and understanding, and because a lot of times you'll have a child that speaks the language, but you're talking about a 30-year-old woman or however old, trying to explain what's happening to her to a 5-year-old boy or girl, and them trying to translate that to someone that can help. And that there's so many gaps there and so many things that fall through. And it's important that we all are able, since we are such a melting pot here in the U.S., to be able to do that work. And so if you're interested in that, you can donate to our page at Innovation Family Wellness Incorporated. We have our Facebook. It's also on our website, which is easy. It's tfwok.com. And then, if that's not your thing, you can volunteer with your local NAACP. A friend of mine has 100, I think, what's David Harris's group?
100 Black Men.
100 Black Men. They're raising money for funds, and they work with youth and students and there's all kinds of organizations out here that you guys can help with.
Tulsa is really good about having lots of connection and organizations for people of color.
Yeah.
But we need more.
We do need more, and we need more support, because we'll have them, but then it's hard for them to get somewhere, And so not only protesting, but once the protests are over, where are you willing to spend your time and actually put in some work? Mm-hmm. So, people say, put your money where your mouth is. I don't necessarily need your money if you don't have it, but having your time and your skills to help, get these things done, and taken care of would be amazing.
Connection, education, empowerment, all of those things, the more we know about each other and what disparities, because I think what we were talking about the other day is within the group. So Montika is a part of a group that's all is holistic breastfeeding, and that's a very small group already. So then you take women of color that are a part of that group, and then that makes it even smaller. And so we start being disconnected with tapping into reaching people that really need the information and really need the support.
Right.
And so if you are a part of a group that can help support, get on board, find some local people that are doing work that way and start supporting them, asking them about. And that's one thing I think we can do as people in general. But what I want to see, I had made a comment on a Facebook page. I don't do Facebook comments very often, but if we don't service the minority people in our country, we're doing a disservice to America. Right. Also, we have to support these smaller groups that support bigger groups. We like supporting the mom and the baby, then supporting the family. It is really important.
Yeah. And supporting the children and the teens. One of the biggest things too here, the Margaret Hudson program shut down, and that was like phenomenal.
It's been a while.
Yeah, it's been a while. You know what I mean? And that was for pregnant girls that got pregnant in high school, you know what I mean? And they had amazing IBCLCs that used to work, and those girls would breastfeed and do all those things. And so now that's gone, and we don't have a replacement for it, So there's a ton of work that's out here.
We're missing connections with people that need the information, and it is sad because we're just I don't even know.
Yeah. So I think we all, are graced to do something, and we are, blessed to have our niche. So what Crystal does, what I do, this is my thing, working with women and children. That might not be your thing, but everybody has their different little piece, and so you just have to find what you're passionate about and get out there and actually do the work, do some volunteering and help out.
I agree. Yeah. And be open to just in general listening to others. Is it something that you're supposed to? Because I agree, we can't do everything. No. We have to do what we are graced to do, what we're called to do. But a lot of us aren't doing that. And so if we're not doing that, if we're just kind of being in our own world and not contributing, but there's so much. Yeah. And one of the first steps is just understanding your fellow person.
Yeah, and listening to your fellow person. I feel like I've seen a lot of that recently in the past week too. A lot of people just not listening. You see a post. Some are. I think things are changing, and I'm hopeful that things are changing. But a lot of people aren't, and so that's where talking to your friends and family about the different things that are going on, and actually listening to different people's experiences is really, really, really.
It's a human heart.
It's important. Yeah, I believe that. I believe that a lot of this is, all of it.
It's a human heart at the core.
At the core, it's a heart issue, and and a fear issue too. Unfortunately, but I think we're going to end this for tonight. Yes. Because I am tired, but I did want to jump on and talk to you guys about, preparing for breastfeeding. Prepare for breastfeeding just like you're gonna prepare for birth. It's important, and it'll make your experience so much better, and so much easier. Unfortunately, I'll say one more thing back. Before we got into this nuclear family pattern, and nuclear family is mom, dad, and kids, or mom, dad, and two kids. When we used to have aunties and grandmas surrounding us, the village. We don't have a village. You see posters like, oh, it takes a village. There's no village. Most of us move away. You know, our parents live in one state, we live in another state, and trying to be a new mama with kids with no family, just by yourself, no support is very difficult. And then when you've never seen anybody breastfeed, because for so long breastfeeding wasn't the thing to do, right?
Yes.
So you don't have any representation, you haven't seen it done, so you're trying to just figure it out by osmosis, and that's not helpful. You need help. So finding different support groups, La Leche League is a good one. There's different Facebook groups, and I run a Facebook group as well called Black Mamas Do Breastfeed. There's a ton of wonderful groups out there, or, you know, I know Donnie is on. You can start your own. You know, she started one when she was in Tampa. You know, where you can come out and moms can talk and make that village. So, yeah, prepare to breastfeed, prepare for pregnancy, take care of yourself. Everybody, be healthy, mind, body, and spirit. Make sure you're taking care of yourself and refilling yourself, you know, even, you know, spiritually, getting in your word. Those different types of things are going to be really, really important during these times. So we love y'all.
We'll see you next week.
We'll see you next week on Friday around...
We were late today. But,
7-ish, probably
7-ish
central time. For
when
those
you are
that
an
out of state.
entrepreneur and have kids, and
Girl, yes,
they all know.
yes. Love y'all. You guys take care. Bye. Good night. I don't know how to end this. Finish. End.
It's starting higher, Betty. Okay.